NFTs and medical specialties. Let's go. What's up, everyone? Mike Muellner here. I'm an internal medicine doctor from Los Angeles, California, and today we're going to go over a very big announcement. I'm referring, of course, to the line of NFTs by our former president. So these are basically digital trading cards depicting various caricatures that all have the president's likeness in very high-profile professions. So things like astronaut, race car driver, professional wrestler. And it got me thinking that there's also caricatures of the different medical specialties. So let's jump right into it. The first one is astronaut. So I would say that this is probably a diagnostic radiology because both radiologists and astronauts have to do very high-level critical thinking, very detailed analysis in extremely dark environments. The astronaut will work in space, whereas diagnostic radiologists work in the reading room, which is a dark room where you have all your radiographs set up, or actually now it's all on flat screen monitors. Actually, it was on flat screen monitors even when I was in med school. I don't know why I said like actually now. I'm not that old. Anyway, radiology was something that I considered for a while back when I was a second-year medical student. I did a summer research project looking at MRI scans and mild traumatic brain injury, did an elective on diagnostic radiology. So it's a career I have a whole lot of respect for. And sometimes I don't think diagnostic radiologists get enough credit because they have to diagnose patients oftentimes without ever seeing the patient in person. Contrast this with my job as a hospitalist. I weigh very heavily my in-person interaction with the patient in order to make a diagnosis as far as what could be going on. Next, we've got cowboy. So this one I'd have to give to emergency medicine. Now, let me explain. Cowboy has a bit of a derogatory connotation in medicine. The term is used to describe a doctor who maybe doesn't really think that deeply, acts impulsively, is very quick to order perhaps unnecessary tests. This is not at all what I mean when I say emergency medicine is like the cowboy NFT. Okay, what I mean is this. The emergency department can be like the Wild West because you don't have the luxury of a lot of time or a lot of resources at your disposal. For example, if somebody comes in with chest pain, an emergency doctor has to act very quickly on very limited data available in order to determine if the patient likely has acute coronary syndrome versus something more like acid reflux, which wouldn't be a big deal. The patient could just go home. And this is very different from what I do as a hospital medicine doctor. Many of the patients that I work with have been in the hospital sometimes 24, 48 hours, sometimes even a week. So I have a whole wealth of data at my fingertips to help me make decisions. But that's not the case in the emergency department. Next up, we got Hollywood. So this one, I guess you'd have to give it to plastic surgery, at least where I live in Los Angeles, California. Plastic surgeons, at least some plastic surgeons, are quite well known for working with the stars, but there's more to the specialty than cosmetic procedures. Plastic surgeons can do reconstructive surgery on people suffering from cancer or traumatic injuries, so there's a lot more to the field than cosmetic procedures. All right, and now what do we got here? Fighter pilot. So for this one, I'll relate back to my intern year of residency. I was working with some people going into radiology, and one of the comments I heard was, interventional radiology is so cool. They're like the fighter pilots of the hospital. And I thought to myself, well, what does that make me as an internist? The city bus driver of the hospital? Now, no offense to other internists, and certainly no offense to city bus drivers, a very much needed job in both instances, but it's oftentimes routine. And I think maybe there is some truth to that. As an internal medicine doctor, I do see a lot of medical conditions that are quite common. Now, contrast this with an interventional radiologist. Now, sure, they do very common procedures. They'll put in feeding tubes, but they also see really exotic, dangerous stuff like abscesses in the abdomen that don't respond to antibiotics. An interventional radiologist will evaluate to place a drain in those situations, and in some cases may be the patient's only hope for recovery. And so, yeah, when the blank hits the fan, if you're in the battlefield, maybe you want a fighter pilot. If you're in the hospital, I think you want an interventional radiologist on your side. Okay, and with no further ado, I saved the best for last. This is, of course, my specialty, internal medicine, or more specifically, working as a hospitalist. And I'm just kidding, by the way. I don't really think this is the best. I think there's merits to all medical specialties. But anyway, this is race car driver. Let me explain here. So I'm not talking about drag racing. I'm not talking about intricate rally car racing, going off-road, sliding around corners. I'm talking about endurance racing, like the Indy 500, because that's what it can feel like as an internal medicine doctor, whether you're working in clinics, seeing 30 patients per day, or you're working in the hospital, doing 7 shifts in a row. Oftentimes these shifts are 12 hours. There's definitely a component of endurance to it. And so for that reason, if I had to pick any of these NFTs, maybe the race car driver would be the one for internal medicine. All right, that's it. I hope you enjoyed this video. As silly as it sounds, back when I was a medical student and trying to pick which specialty I wanted to pursue, I would kind of have these caricatures in my mind. And so that's why it was one of the things that I thought of when I first saw these digital trading cards here. Anyways, if you enjoy content like this, feel free to hit the subscribe button, and I'll catch you guys soon with another video.